Hey guys, welcome to Desk Jockey Physio, where we help active desk folks feel and move better. My name is Mitch Starkman. I'm an FCAMP registered physiotherapist and sports medicine clinic owner here in Toronto. Thanks for stopping by. Hey everyone, two quick updates before we jump into today's video. Number one, we have a free giveaway today. If you head over to deskjockeyphysio.com/guide, you can download your 5-step guide of how to set up the perfect laptop home office, which you can do right here, okay? And number two, we are now offering online physiotherapy sessions for you folks out there. To learn more about that, head over to deskjockeyphysio.com/online, and we'll see you there. All right, otherwise, enjoy the video, guys. Thanks for watching. Hey guys, before we jump into the video, I wanted to take a quick second to share an awesome story from a user here, or you can call it a patient, with a grinding or snapping knee. And so it made it really great for us to we're about to talk about a new program we're releasing, and this user had a great experience with it. So first I wanted to show you a pre-video and a post-video of their knee after using the program. So here's the pre-video, check it out.
For surgery today, clusters. So in your
Nasty stuff, right? So we see that snapping, it's real clear and popping, really painful knee, painful even to walk, do stairs, anything like that. After going through some specific programming, now they did do the level up, so the one-to-one care, so that's a bit more specific, there's a bit more going on, but in our programming that we have, but you know what? It worked. So check out our post video now. Right, so I just wanted to take a quick second to show you kind of pre and post result there of the programming. If you are interested in getting set up with something like that, you can head over to deskjockeyphysio.com/grinding-knee. That's the online program with the upgrade. We also do online training as well, one-to-one, which is at /online. Hope it helps. Anyway, sorry to interrupt. Let's get back to the video. All right, welcome to our cracking and grinding knees video part 2. So we put up our first video of this almost 3 years ago, and it's been one of our most popular videos. We've had lots of questions being asked on it in the comment section and over the years. So I thought I'd just do an update. I wanted to answer the most popular question, which is, what is the anatomy of this? Why is this happening? How is it working? We're going to answer that today. And then I also want to offer another solution. So what we've done is we've gone ahead and created a pre-phased program for how to treat and manage this issue at a really inexpensive cost. If you would like to check that out, you can find it on our website, deskjockeyphysio.com/cracking-knees. Okay, and if you check that out, there's a program in there you can go to take you from start to finish. We also offer one-on-one care at deskjockeyphysio.com/online, and hopefully that can help as well. I'll put those links below. But in the meantime, I want to go over the anatomy of this, how it can help, and the first video still has super relevant content as to how to fix this and get started with it. Okay, but a little bit more idea of this going here. So I have some tools here to guide us through. Now, if we're looking at my knee here, right, I want to use some equipment. So here you can imagine that's the top of my knee. My femur comes down, and that's you can imagine the bottom of the bone. This on top is the kneecap. Okay, that kneecap sits in that groove. So you can see this groove here that it sits in. Now, as I bend and straighten my knee, this bone doesn't move, but this kneecap or this ball does. So kneecap on top of my knee, as I straighten my knee, it's going to roll back behind. As I bend it, it's going to come forward. So it needs to sit nice and smooth in that groove, back and forth, right? That all makes sense, right? I'm looking at this position here. It needs to come back and forth. Now, where problems come into play here is in the event that some folks are tighter into these muscles here. So if my quad muscles that wrap around are tighter, that wrap over top of this system on here, then they will compress that down. So now we're adding more vectors of force going downwards on this ball or the kneecap into the bone below. And that's where that grinding comes from. Now, as long as it's sitting central, that's okay, right? It's gliding still in that little bit of a groove, it's okay. But when that starts to shift, sometimes you'll see that kneecap will get so tight or stiff on one side that it will pull more towards one direction. Now you're grinding one side versus the other. It's no longer equal, almost the Leaning Tower of Pisa. And so you will grind one side more than the other. And yes, that can lead to things like arthritis down the road. Now, a little bit of cracking here and there is normal. These are supposed to crack. They're joints just like anything else. Our knuckles crack, right? These things all sort of do these things. But most importantly is it happening consistently and often? If it's happening consistently and often, yeah, it's something you want to do something about and try to work on, which is why we created this program and other exercises that you can do, like foam rolling your quadriceps, strengthening your glute muscles, all of these things. So just to review, this and this, you want it to move nice and smooth or nice and straight on here, right? If it is moving off the rails or grinding on the outside, it's a problem, and yes, you'd want to do something about it. So that's the anatomy review. Just again to mention, you can always go back to our first video and watch some exercises on how to handle or manage this. If you need a little bit more guidance, we've also created this program on our website, link below. And if you have any questions, please feel free to leave them below in the comments. So like us if you like this, please share it with your friends. Subscribe to the channel, and of course, move like you mean it.